or jaundice, a little bit yellow, with their pain. Take the painful jaundice again. Never go with painless jaundice. That's bad. And it can result in acute pancreatitis when you obstruct the pancreatic duct, and we'll be seeing that in a little while. In general, if your patient has a bilirubin of greater than 3 to 4 milligrams per deciliter, that's an indication that there is obstructive biliary process going on. So in those patients, you really need to, if they have cholecystitis, if they have elevated bilirubin, you want to go on to either getting the MRCP, or the patient should maybe even get an ERCP. Sometimes it can be hard to see the cloidochal lithiasis, and especially in a patient who isn't allowing for that really deep interrogation with your ultrasound probe. So you're going to be really good, and you're going to look at every single sweep, especially in any common bile duct more than 6 millimeters. You're going to look really carefully at the sweep as far as you can, because of course your technologists are busy and they're having the hardest time getting those images. It's on you to look at all of them and try to find that obstructing stone, so that you don't have to go into an MRCP. If you have an obstructing stone in the common bile duct, it's an indication for an ERCP prior to cholecystectomy in our hospital. We don't do a T-tube injection any longer. We always get an ERCP, but then you're bringing in a GI doctor who is very comfortably asleep. So you need to do that knowing you have a stone, knowing they have a nidus for intervention, knowing that patient needs a sphincterotomy and a delivery of that stone, because they are usually in exquisite pain. Let's talk about some of the findings we saw of these stones. So our patient on CT scan had what's called the rim sign. I always like the spinning rims, or crescent sign, but sometimes we like things to be food or target. There's a million ways to say this, but these can be subtle on imaging, so you're always going to look for that crescent of bile around a stone. If